प्राची, गुड मॉर्निंग. म्यूट आहे.
गुड मॉर्निंग मॅडम.
कसं आहे, बरं आहे का?
हो हो.
गुड गुड.
बंद पडेल सगळं. लावा सगळं.
अमोल शेळके सर, तुमचं म्यूट करा. योगिता मैडम,
प्लॉट नहीं रहेगा एज दिख रहा है पूरा पर शेप कैसे आएगा प्लॉट को? वो टूटा हुआ है, प्रॉपर शेप आया है दोनों जगह.
नहीं, एज फार एज अगर क्लॉट रहेगा वो तो यूरिन प्रोटीन में आ जाना चाहिए. लॉट्स ऑफ पसल्स.
हाँ मतलब
आइडियली
हेलो पूजा.
आई फील ना उनका कैथेटर चेंज कर देता है.
पूजा घुले, प्लीज म्यूट योरसेल्फ.
अरे डियर, इट इज नथिंग लाइक दैट. मतलब ब्लैडर के कैथेटर इनसाइड टिप पे कुछ मिल सकता है.
अमोल शेळके सर, प्लीज सगळ्यांना म्यूट करा.
कुछ फर्क नहीं पड़ता है. आपके इधर?
है ना पूरा बंडल, ये देखो ये उसका शेडिंग है, मुझे आर्मी से भी लिखना है ना उतना, तो वो हॉस्टल्स वेरी प्रोफेशनल आर्मी।
चलो जाते हैं।
आरबीसी तो इक्का दुक्का दिखा दो दिखा।
हमको कुछ नया सीखा है। फोरेन टाइप से कुछ नया देखना हमने।
अरे सुबह है वही काम पे लग गया है ना, ये चालू
और अपने को नहीं पता।
और ये मुझे पूछ रहे हो वन
मेरी डायरी नहीं
करतोय सगळ्यांचं
देखती है सेकंड पर।
करा हो हो तो करतोय त्याच्या
अरे बाबा
दोन मेडिकल फील्ड आहे, सर्व बीच होते
मी बोला.
Sandeep sir, welcome.
Good morning, madam. Happy
World Health Day.
Good morning, madam. Happy World Health Day.
Thank you. Thank you. Same to you.
Good morning.
Good morning, madam.
संदीप आपण प्राची मॅडम न ओळखता ना?
हो हो, एक दोन दिवस माझं फोनवरती बोलणं झालेलं होतं.
हो, फोन वरनं झालेलं आहे. प्रत्यक्षात आपण
हो.
Okay. Prachi, Sandeep is very versatile and very active person.
Yes, yes.
And in his through his presentation only you will know that he is into community
Yes,
in public health.
There was some project for that. I had contacted him. I don't know what happened later on. It became some, but I had contacted him for one project. I was recommended he will do it, but I don't know. Later on that project, I think it did come up.
Okay.
Participants are joining, so we will wait for 5 minutes.
Just we'll wait for 5 minutes and we'll
Yes.
start. By the time people will keep joining. many are having holiday, and plus today
Today is Good
mostly,
Friday. Yeah.
yeah, Good Friday, people attending church and all.
Church
So
and all, yes.
yeah, let's see.
होतंय का? ते शेअर स्क्रीन आहे ना, फुल स्क्रीन. येतोय का आवाज? आवाज येतोय का?
Good morning.
Hello. Good morning to one and all, and happy World Health Day to everyone. The theme is stay healthy, be safe. So on the of year making collaborative activities, I welcome Mrs. Surekha Sawant Madam, TNI President, Maharashtra State Branch. TNI Secretary of I also welcome for joining the webinar. I also thanks to all the consecutive members for giving us the opportunity to organize this collaborative activities with Dr. K. Patil Foundation, Ahmednagar.
Hello.
Yes, madam.
Voice was breaking. Shall I welcome address? Shall I start with the welcome address?
Yes, madam. Yes, ma'am. You can start.
Okay. Good morning, everybody. Distinguished guests, participants, my fellow nurses. As a Secretary TNI Maharashtra State Branch, it is my pleasure to welcome you all for this wonderful webinar in collaboration with Dr. V.V. Foundation, College of Nursing, Ahmednagar, which is being held in celebration of World Health Day. This day is celebrated every year on 7th of April to mark the anniversary of the foundation of the World Health Organization in 1948. The theme for this year is Health for All. This theme underscores the need to work together to ensure that everyone, everywhere, has access to health services they need without experiencing a financial hardship. COVID-19 pandemic has brought into sharp focus the importance of health for all. It has demonstrated that health is not just an individual issue, but a collective one. The pandemic has highlighted the need for global solidarity and cooperation to ensure that everyone, regardless of their income or social status, has the access to healthcare. They need to stay healthy and safe. On this occasion, we have gathered here to discuss how we can work together to achieve the goal for health for all. We have a distinguished expert, Dr. Sandeep Kare, DPHN Ahmednagar, who will share his insight and experiences and how we can improve the access to the healthcare, especially in our country or in our communities. I'm sure this webinar will provide us with a platform to exchange ideas, new perspectives on how we can contribute to build a healthier and more equitable world. I hope this discussion will generate innovative solutions also. Once again, I welcome one and all to this webinar. I also take this opportunity to thank Dr. Pratibha Chandekar, Principal, for organizing this webinar. I hope that you will find it again. Thank you, everyone. Over to you,
Thank
Dr.
you.
Yogita, ma'am.
Yes. Thank you, madam, for such a vibrant speech of welcome. We are very happy to hear you again. Thank you. I'll just have an introduction of our speaker in brief. Mr. Sandeep Annasaib Kare is the district public health nurse at Jilla Parishad Ahmednagar. About the professional qualifications, sir has completed his BSc from DY Patil College of Nursing, Pune. He has also completed MSc Nursing from DY Patil College of Nursing, Pune. He has also completed LLB from DY Patil College of College, Pimpri. About the sir has completed the various advanced trainings listed few here: advanced cardiac life support and basic life support with the American Heart Association. Then sir has completed 109 orientation courses of National Service Scheme held at MHS Nasik. He has also had been counselor for the training course organized by the Indian Red Cross Society and Junior Red Cross Society Pune district branch. About the work experience, sir has the vast experience in as a master trainer in Johns Hopkins University JEPNET project for improving the quality of care in the labor room for the year of 2014. He was a clinical instructor for 1 year. After that, he was master tutor for 4 years, lecturer for 4 years at DY Patil College of Nursing, Pimpri. He was been a ICU staff nurse for 13 months at Dinamanath Mangeshkar Hospital, Pune. Sir has also had a NSS program officer's responsibility as an advisors, counselor of Junior Red Cross Society, secretary for Alumni Association of Padma Shri Dr. DY Patil College of Nursing, Pimpri, Pune. He was been a treasurer for TNI Pune City branch for 3 years. About sir's other activities, sir has conducted a training program sessions for Tata Motor Pune Village Health Workers, moderator. He was also a moderator and paper setter and dissertation evaluation examiner for various centers. He was been central observer for the examination theory at DY Patil, Pune. He has also participated and organized various conferences and workshops. Listed it few here. He has arranged the 23rd TNI Biennial Conference at Pune, then organized a workshop on current issues in the nursing, future scopes for the nursing at abroad. He has also been a member of National Conference at Pune. He has attended the continuing medical education like research methodology and biostatistics, application of nursing theories in the nursing research, participated in Indo-US Education Conclave in 2011, held at Pune, and also been a member for IMNCI training. Regarding the research activity of the sir has undertaken the research project and served as a research guide for the PG students and presented a paper at the national and international conference. For the membership, about the membership, sir is a life member of a Society of Midwife, Trained Nurses of Association of India. He is also an alumni member of DY Patil College of Nursing. And he has also had a various committee members at a district level, listed few COVID Warrior Task Force Committee member, District Routine Immunization Task Force Committee member, District Review Committee member, District Maternal Death Review Committee member, District Florence Nightingale Award Committee member, and this is a list goes on. So I welcome you, sir, for the your session. Thank you so much. Over to you, sir.
Thank you, madam, for a broad welcome. First, all of you having the Happy Health World Health Day. And I want
Sandeep, just can I interrupt?
Yes,
now, in this Zoom link, we have 100 participants, but then those who would like to join, even other people who would like to tell them. So there is also, we have provided YouTube live streaming line also, so they can join. it is there in the MUHS group also, in different groups also. So now because it is already 98 participants are here, so maybe just it is just a information, people can join even in the YouTube link also.
Thank you,
Yeah,
madam.
you please continue,
Yes.
Sandeep.
Yes.
Thank you, madam. First, thank you for the organizing committee member, TNA State Branch, for organizing and inviting me for as a guest speaker. We'll start with my presentation. I will slides. On 7th April 2020, World Health Day, the World Health Day organization will observing, likely Prachi Madam said, as a 75th anniversary of the WHO. In 1948, since 1948, countries of the world came together and founded WHO to promote health, keep the world safe and serve the vulnerable. So everyone, everywhere can attain the highest level of health and well-being. As a 75th anniversary year is an opportunity to look back at the public health success that have improved quality of life during the last 7 decades. It is also an opportunity to motivate action to tackle the health challenges of today and the tomorrow. This year theme, on the basis of all this, they are given health for all. In terms we'll see in detail. What is the meaning of the health? Concept of the health we'll see in the book picture. It will promote, protect, and restore the health of individual and population, and integrated discipline of the public health or the community health came into existence. A lot of public health evolved in the India since independence, and we have achieved success in terms of improvement of various morbidity and mortality indicators like the maternal mortality rate, infant mortality rate, neonatal mortality rate, child mortality under 5 children mortality rate, total fertility rate, so and so. However, a lot needs to be achieved, and the mid-level healthcare provided can play an important role in this regard. Health means will give the different definitions in the different books. It differently, while some feel health is a freedom from any diseases, others consider it harmonious working of all organs of the body. But WHO has given definition of health as a state of complete physical, mental, and social well-being, and not merely an absence of disease and infirmity. We'll see the health regarding 3 concepts like illness, sickness, and the diseases. Illness refers to subjective sense of feeling unwell. It does not define a specific pathology, but refers to a person's subjective experience of it, such as discomfort, tiredness, general malaise. Sickness, it will refers to socially and culturally held conceptions of health condition like the threat of cancer or the stigma of mental illnesses, which in turn influence how the patient reacts. Now, disease refers to the physiological and the psychological. In other words, we can see the disease implies a that may or may not be produce symptoms, and that result the patient illness. If you give the example like a patient complains the age particularity, his illness as I experience it, he consults a doctor about it because he believes that he might have a sickness. The doctor might attribute the patient's symptoms to anemia, which is the physiological dysfunction. Now we'll see the health is not a static state. It keeps on fluctuating across the spectrum. It ranges from complete well-being to uneasiness, disease, disability, and up to the death. Health for all envision that all people have good health for the fulfilling life is a peaceful, prosperous, and sustainable world. The right to health is a basic human rights. Everyone must have access to the health services they need when and where they need to without financial hardship. 30% of the global population is not able to access the essential health services. So the WHO has given the theme for this year is the health for all. To make health for all a reality, we need to individuals and communities who have access to high quality health services so that they can take care of their own health and that their families, skilled health workers providing quality people-centered. Evidence show that the health system powered by primary health centers approach is the most effective and cost-effective way to bring services for health and well-being closer to the people. COVID-19 and other health emergencies, overlapping humanitarian and climate crisis, economic constraints, war have made every country journey to health for all more urgent. Now for this health for all, they have taken the concept will correlate with the progress need to be accelerated like the sustainable developmental goal. The WHO has recommended the 17 sustainable developmental goals listed here. First, out of that, the third one is the good health and well-being. That is the indirectly contribute for the health for all. There are the 17 goals like no poverty, zero hunger, quality of education, gender equality, clean water and sanitation, affordable and clean energy, decent work and economic growth, realistic infrastructure, inclusive and sustainable industrializations and innovation, reduce inequality, sustainable cities and communities, responsible consumptions and production, climate actions, life below water, life on land, peace, injustice, and strong institutions, partnerships to the goal. These are the 17 sustainable development goals are given. Out of that, 3 is related to today's theme, health for all, that is good health and well-being, ensure healthy lives and promotive well-being for all the individuals. Of these sustainable development goals has ensured given the targets. Some of the targets will see the first, they are given the maternal mortality rates. It should be reduced by 2030 70 per 1 lakh live birth. Neonatal and child mortality rate by 2030, it should be a less than 12 per 1,000 live births, and under 5 mortality rate should be a 25 per 1,000 live birth. Infectious diseases like AIDS, tuberculosis, malaria, neglected tropical diseases and combat hepatitis, waterborne diseases, others communicable diseases should be minimized. Non-communicable diseases burden should be reduced 1/3. Substance abuse like mainly for the narcotic drugs abuse, harmful use of alcohol, tobacco consumptions, by road traffic accidents, the number of global death and the injuries from the road accident should be a decrease. Sexual and reproductive health, it should be universal access to the sexual reproductive healthcare services, including the family planning, information, education, and integration of reproductive health into a national strategies and the programs. Universal health coverage, it should be a provide including financial risk protection, access to quality essential healthcare services, and access to safe, effective, quality, and affordable essential medicine and vaccines for all. Now, last one is the environmental health target, sustainable, reduce the number of death and illnesses from hazardous chemicals and air, water, and soil pollution and contamination. Healthy living and empower individual families and communities for increased social participation and enhanced self-care in health, ensure informed and active participation with people at the center of health decisions and the outcome. The health for all, the ultimate goals. I have making presentation in this sustainable development goals themes. First one is the saving the lives of mothers and children. One of the great public health achievement for the past decade related to the health of the woman and the children, resulting from the dramatic increase in stillbirth attendance, childhood vaccination, and introduction of methods such as the CIM and today and before. Between 2000 and now, mortality among children under 5 and pregnant mothers have had impressive progress in protecting the health of the most vulnerable. More pressing concerns such as the mental health, obesity, impact of COVID-19 pose increasing challenges requiring in the new solution and renewed energy. Now, for the protecting the maternal and child health, RMNCH Plus, the Government of India Call of Action CAT Summit in February 2013, the Ministry of Health and Family Welfare launched reproductive maternal newborn child first adolescent health to influence the key inventors for reducing the maternal and child mortality, morbidity and mortality. This concept is about the holistic in design, encompassing all interventions aimed at reproductive, maternal, newborn, child, and adolescent health under a broad umbrella, and it focusing on the strategic life cycle approach. Maternal health. Right now, the government as a grassroots levels, they have implemented some important program I highlighted here. First one is the JSSK, Janani Shishu Suraksha Karyakram. It is launched in the June 2011. It is main objective of this program is the out-of-pocket expenses from both the pregnant woman and the sick infant should be a decrease. In 2014, the program extended to all over the antenatal, postnatal complication of pregnancy, and similar entitlement have been put in place for all sick newborn infant up to 1 year of age, assessing public health institutions for the treatment. Next program is the JSY, Janani Shishu Suraksha. It is main implemented is the objective in reducing the maternal neonatal mortality by promoting the institutional deliveries among the poor pregnant women. The scheme launched in the 12th April 2005 by the Honorable Prime Minister. Third scheme is the PMUY, Pradhan Mantri Surakshit Matru Vandan Yojana, was announced in the Prime Minister address to the nations on the 31st December 2016 to benefit the pregnant woman and lactating mother. Rupees 5,000 payable in 3 installments. They have given the first installment as soon as she has registered as an ANC register on the MCP card, and within the 150 days from the LMP, she has required register on the portal. She will get the 1,000 of the cash benefit. Second installment, she has completed his ANC checkup and she has completed 180 days from the pregnancy. Then she will get the 2,000 entitlement. And third installment, after the child has done the birth registrations and child has received the first cycle of the immunization of 6 weeks, that is the pentavalent first, OPV first, IPV first, rotavirus first cycle, then she will get the 2,000. Likewise, the 5,000 in the 3 installments, government is paying to the DBT, direct bank transfer scheme. Fourth program is the Suman, Surakshit Matrutva Ashwasan. Likewise, we have seen in the presentation that the quality of the health infrastructure should be improved. So the Ministry of Health, Family Welfare, Government of India has launched the new initiative, namely Suman, is aimed to provide assured, dignified, respectful, and quality healthcare to no cost and zero tolerance from denial of services for every woman and newborn visiting the public health facility in order to end all preventable maternal newborn deaths and morbidity and provide a positive breathing experiences. The expected outcome of this initiative was zero preventable maternal and newborn death and high quality of maternal care delivered with dignity and the respect. This scheme was launched in the 2 October 2017. Next scheme was the Labor Room and Quality Improvement Initiative, Lakshya. It is the percentage of institutional birth in India doubled from 38.7% to the 78.9% in the decade 2015-16, according to the National Health Family Welfare Survey. However, this increase in the coverage has not translated in the consummated reduction of maternal and newborn mortality and stillbirth, one of the major factors being induced in the quality of care providing the health facility. So Government of Maharashtra and the Ministry of Health and Family Welfare has launched this Lakshya program on the 11th December 2017. The Lakshya is mainly for the quality improvement initiative in the labor room, maternity OT, aimed at improving quality of care for mother and newborn during interpartum, immediate postpartum period. Next program is the Dakshata implementation package. It is mainly for the During for the institutional delivery strategic initiative, strengthening the quality of intra and immediate postpartum. Dakshata, Lakshya, and Suman is mainly for the quality assessment indicator. Is the maternal death response system, MDSR it is called. It is mainly the process of maternal death surveillance and response system. Include the maternal death review has been institutionalized across the country, both at facility and in community, to identify not just the medical cause, but also some of the socio-economical, cultural determinants, as well as the gaps in the system, which contribute to this death. This is with the objective of tackling corrective action at appropriate level and improving the quality of obstetric care. Next one is the Pradhan Mantri Surakshit Matrutva Abhiyan, PMSMA. Honorable Prime Minister of India highlighted the aim and purpose of this PSMA in the 31st July 2016 in the episode of Man Ki Baat. It was launched to provide fixed day assured, comprehensive and quality antenatal care universal to all pregnant women in second and third trimester on the 9th of every month. The main approach of this system is to engage the private sectors, which includes motivating private practitioners to volunteer for the campaign, developing strategies for generating awareness and appealing to the private sector to participate in Abhiyan at government health facility. One of the critical components of this Abhiyan is identification and follow-up of high-risk pregnancies, and red stickers are added onto the MCP cards of the women with the high-risk pregnancies. They have listed some of the 10 conditions of high risk and with their percentage. PIH, pregnancy-induced hypertension, is the 8%. Prematurity is 7%. Gestational diabetic mellitus, GDM, is the 5%. Previous LSCS 5%. Teenage primary pregnancy is 3 to 5%. Breech presentation 3 to 4%. Severe anemia 2%. Multiple pregnancy 2%. APH antepartum hemorrhage is 1 to 2%, heart diseases is the 1%. Like all this health, these are the preventable maternal death causes you can prevent. The government has entitled about to all the private gynecologists help during this PMSMA campaign and improve the quality of maternal health services. Now we'll see the maternal mortality ratio as per the SRS 2014 and 16. India's was 130 and Maharashtra was 61. Now the SRS bulletin 2019-20, it was 97 and 33. You see the dramatic decrease in the maternal mortality rate. This is the few initiatives I have listed above, like just now I have elaborated, so that it is going to change, decreasing. Now we'll see next component is the child health. Child health, the government has launched so many schemes. Out of that, we'll see the child health population as per the 2011 census. That is the around 26 millions of India. And we share of these 0 to 6 year children account around 13% of the total population in the country. This program is addressing mainly to decrease the neonatal mortality rate, infant mortality rate, and the under 5 children mortality rate. The government has launched some of the program I have listed here. The special newborn care. This is one SNCU at district level with the 12 to 20 bedded. Newborn stabilization unit at the FRU level or the community health RH, SDH level, 4 bedded. Newborn care corner. It is 1 bedded facility attached to the labor room and operation theater for provision of essential newborn care in BCC at each facility where delivery are taking place should be established. The facility-based IMNCI also elaborated earlier also. Mainly, IMNCI focus on the providing appropriate skill for the inpatient management of major causes of neonatal childhood mortality such as asphyxia, sepsis, low birth weight, pneumonia, diarrhea, malaria, meningitis, severe malnutrition, etc. in the children. Mainly, they will give the 11 days training how to prevent and how to tackle these emergencies. Next program is social awareness and action to neutralize pneumonia successfully, namely as the SANS. The government of Maharashtra has initiated this program from the 16 November 2019. His main aim is rule out the His main aim to assert the action against childhood pneumonia by generating awareness around protect, prevent, and treatment aspect of childhood pneumonia, and to enhance early identification and care-seeking behavior among the parent and the caregiver. Home-based newborn care HBNC, the scheme has launched for the ASHA is providing the home visiting with the specified schedule up to the 42 days of life of the child. HBYC is the program was launched in the 2018. This is mainly for the ASHA will provide again the home visiting of the quarter every 3 monthly, that third month, 6 month, 9 month, 12 month, 15 month, to promote early initiations of breastfeeding, exclusive breastfeeding till 6 months, and continue breastfeeding till 2nd year of life among the adequate complementary feeding, provision of childhood pneumonia, diarrhea, and to ensure age-appropriate immunization and early childhood treatment. Also, with this visit, she will visit for the low birth weight babies, SNCU, NRC discharge babies for the visits. Next program is strengthening facility-based pediatric care, Navjat Shishu Suraksha Karyakram, infant and young child feeding, nutritional rehabilitation centers, mainly for the SAM children, will admitted here for the nutritional rehabilitations. After weight gain, they get the discharge. Supplementation with the micronutrients, mainly this is for the vitamin A deficiency. We'll see that the prevalence of the vitamin A deficiency should be below 0.5%. For these strategies, government has launched the scheme and they are providing up to the 1 year of the child. 9 months to 1 year is the 1 lakh international unit of vitamin A. 6 months to 9 month child is given the 50,000 international unit of vitamin A, and 1 year to up to the 5 years of child will give the 2,000 international unit of the vitamin A. It should be given up to the year of 5 years. Next program is the Intensified Diarrhea Control Fortnight, IDCF. It is started in 2014. Mainly, it is during this fortnight, health worker visit the household of under 5 children, conduct community level awareness generation activities, and distribute ORS packet to the families with the children under 5 year of age. Mother's Absolute Affection Program, mainly it is emphasized, started in the August 2016 and will undiluted focus on the promotion of breastfeeding. Next one is the RBSK, Rashtriya Bal Swasthya Karyakram. This program is involves screening of children from the birth to the 18 years of age for the 4 Ds. 4 Ds like the defect at birth, diseases, deficiency, and developmental delay. They will screen around the 52 common health conditions divided into these 4 Ds. And this will focus early detection and pre-treatment and management, including surgeries at the tertiary level. For example, birth defect is the cleft palate surgeries will be conducted free of cost. Heart diseases or the heart treatment, heart surgeries will be conducted free of cost. And for this, currently the government has launched a Jagrut Palak Sutrod Balak Abhiyan. It's still ongoing for the children up to the 18 years of the age. Mainly, again, the basic theme for this Jagrut Palak Sutrod Balak Abhiyan is mainly based on the RBSK. Due to COVID pandemic, you are not able to visit and screen the schools. So the government has launched this Abhiyan, and during this Abhiyan, again, you have to screen. Routinely, every 6 monthly or yearly in twice, they are examining, visiting the school Anganwadi, and school examination or children examination will be done. We'll see kangaroo mother care. All of you know the Janni Shishu Suraksha Karyakram National Newborn Week will be celebrated 15 to 21 month, November. Infant mortality rate ratio, we have seen that India's, as per, again, it is SRS bulletin only. In 2010, we are seeing the India was 47, Maharashtra was 28, and now in 2022, India is the 27 and Maharashtra is the 16. This is a dramatical change or decrease in the infant mortality rate due to all these new initiatives the government of Maharashtra and the Central Family Welfare Department has done. Now the third option is the point is this is the family planning. That is the mainly family plannings, all of you know, mainly they will elaborate only the three categories in which the what factors influencing the proper population growth. First one is the unmet need of the family planning. So as per the NFHS 5, the 9.4 of our country, spacing between the birth, SRS 2019 data shows that the India spacing between two children is less than recommended period of 3 years in the 49.1% of the birth. Age at the marriage and the first child birth, that is the NFHS 5 survey, 23.3% of the girl get married below the age of 18 years, and out of total delivery 6.8 are among the teenagers, that is the 15 to 19 years. The situation regarding this will be alarming state like Bihar, Rajasthan, Jharkhand, UP and MP. Dealing is age at the marriage and the first childbirth coupled reduce the impact of population momentum and the population growth. Government is making a bill that the age at the marriage should be at 20, girls age marriage age will be at 21 years. It is bill is pending at the parliament level. We'll see the fertility rate as per the SRS. This is India's fertility rate. In 2005 it is 2.9 and now at the 2020 it is 2.0. It is happened due to the various our spacing methods. If you know the spacing methods, IUCD, 380, CUIUCD, injectable contraceptive, MPA, combined oral contraceptive, Centromain, condom. Out of that is the MPA, injectable contraceptive, Antra program and Centromain Chaya. These are the new initiative government has launched. And out of limiting methods, all of you know, the emergency contraceptive is the pills are launched. These are the three mainly contraceptive methods government has initiated in our program. Likely I will elaborate on the MPA. It is the injectable MPA. Is an intramuscular hormonal contraceptive method for women that provide 3-month protection against with the single dose. It is given every 3 monthly to the intramuscular injections. And next one is the Centromain Chaya. Chaya is initiated in the government has in market. It is named as the Saheli tablet. Mainly contains the Centromain. It is safe spacing for the both breastfeeding and non-breastfeeding mothers also. First, it should be taken twice a week for the first 3 months and then once a week. It should be begin advised to take the first pill on the first day of the period and the second pill that is the 3 days after that is the 4th day of the bleeding, and then up to the 3 months she has to start. If the pill will continue up to 3 months, then she will start with the weekly schedule regardless of her menstrual cycle. If suppose she forgot to take the pills, she should take the missed pill as soon as she remember, and that is she has missed. But if she misses taking the tablet 1 to 2 days, less than 7 days, she should take the missed pill as soon as she remember and continue the normal schedule. If she is more than 7 days, she has to discard the current packet and start as a new user like a twice a week for 3 months and followed by once a week later. It is benefited for the anemic mother and safe for the breastfeeding woman also. And those having the not recommended use of hormonal methods, it can be used. Next one is the emergency contraceptive pills, EG pills. It is given the name. Under the National Reproductive and Child Health Program, the Drug Controller of India has only approved levonorgestrel LNG 0.75 mg tablet for the use as an emergency contraceptive pills. The emergency contraceptive pills must be properly taken within the 72 hours of an unprotected act of intercourse, the earlier the better. Best if it is taken as soon as possible after the unprotected act and as a single dose of 1 tablet or 2 tablet as of 1.5 mg. 0.75 mg is the tablet strength. Second tablet she want to take, she can take after 12 hours. These are the 3 new initiatives. Others I will not elaborate. These are the some ISC materials you have prepared at our level for the general public awareness. Will not go in detail. New concept is the PPIUCD, postpartum intrauterine devices. It is now initiated, and after the as soon as delivery, the copper T is inserted. It is called the PPIUCD. Now we'll see the adolescent health RMNCH component next. MNCH adolescent health is first one is the RKSK. Mainly this adolescent health problem are the preventable problem like early and unintended pregnancy, unsafe sex leading to STD, HIV/AIDS, nutritional disorders like malnutrition, anemia, overweight, alcohol, tobacco, and drug substance, mental health concern, injuries, and violence. Now the government, I listed a few programs like RKSK, Rashtriya Kishore Swasthya Karyakram. This is the holistic development of adolescent population. The Ministry of Health and Family Welfare launched Rashtriya Kishore Swasthya Karyakram on 7th January 2014. It is mainly a program extended for the scope to provide the limited to sexual and reproductive health. It now includes in its ambit nutrition, injuries and violence, including gender-biased violence, non-communicable diseases, mental health, and substance abuse. The strength of program, it is the health promotional approach. And under this is the next is the adolescent-friendly health clinic. The approach was initiated 2006 for the urge clinic to provide counseling on the sexual and reproductive health. Mainly they will provide again all these, they will counselors are appointed and they will counsel for the adolescents. Third program is a menstrual hygiene scheme. The government was implemented since 2014, wherein the pack of 6 sanitary napkins called Free Day was provided to the rural adolescent girls for the RS of 6 rupees. Next one is a peer education program. Name itself, you come to know that it is the peer. Peer means their own school children. They are the peer educators, mostly 2 boys and 2 girls are selected from the same villages or the same college, schools and college. They will train for these adolescent health programs. They have given the kit as per the peer educator kit. They will train and they will counsel their members. Each person will given the 15 to 20 boys and girls. The boys will counsel only for the boys and girls will counsel for the girls. Next program is a weekly iron folic acid supplementation. It is called the WIPS. The government has meet the challenges of high prevalence and incidence of anemia among the adolescent girls and boys. WIPS evidence-based programmatic response to the prevailing anemia situation among the adolescent girls and boys throughout supervisory weekly injections of IFA supplementations. With that, we are providing the biennial helminthic control, that is with the help of tablet albendazole will give as per the age. For the 1 to 2 years, it is given 200 milligram, and for 2 to above age group, it is given 400. Now the new program government has started in school health wellness program in the February 2020. It is mainly provided mainly for the healthy life, healthy behavior, recognize the importance of school-based health promotion activities and be intercorrelated. In this program, 2 teachers, preferably 1 male and female teachers in every school design as a health and wellness ambassadors. It will be trained, this ambassador will be trained, transact with the school children, health promotion and disease prevention information on the thematic area in the form of interesting, joyful, intensive activities of 1 hour for every week. Once 1 hour in a week, they have to provide, like these are the some of the thematic areas I have highlighted for the primary school, middle school, and the high school. Mainly for the nutrition, personal safety, hygiene practices, preventive diseases, mental health, meditation, road safety, violence. All these are the thematic areas this program will be implemented, and they will provide the information. Now this government has launched about the one more program is the prophylactic IFA tablet supplementation resin. It is called as the AMB, Anemia Mukta Bharat. If you have heard that from the 6 month of child to the 49 years of the woman, they have provided the iron folic acid supplementations. We'll see the, as per the age group, for the 6 months to 59 months child, they have given the biweekly 1 ml iron and folic acid syrup. And 1 ml, this 1 ml will contain the 20 milligram elementary iron and 100 microgram of folic acid. It is a 50 ml bottle. It is given with the relatives, and they are told to provide the bi-weekly, in twice a week, they have given the 1 ml of iron syrup. 5 to 10 years, these are the school-going children, likely weekly 1 iron and folic acid tablet is given, and this tablet color is pink color. They have distributed various color, pink, blue, and red. Likewise, these 5 to 10 year children, the tablet is given the pink tablet, and it contains 45 milligram elementary iron and 40 microgram of folic acid. Adolescent girls, likely I have stated right now the WIPs for the 19 years of age. They have provided this iron tablet. It is 60 microgram elementary iron and 5 microgram folic acid. Its color is blue. For 5 to 10 year children, it is pink. 10 to 19 years color is the blue color. Now, woman of reproductive age, non-pregnant woman and lactating up to the years of 49 years, she has to consume weekly 1 iron and folic acid tablet, each tablet containing 60 microgram elementary iron, 50 microgram folic acid, and this tablet is the red in color. Pregnant woman and lactating mother also given the same tablet, and it is throughout the pregnancy, minimum 180 days during the pregnancy and counted for 180 days postpartum. Each tablet containing 60 microgram elementary iron, 50 microgram folic acid. These 2 tablets are the red in color. This color coding is given for the easy understanding, and it is easy to identify the which age group the tablet is. The second aspect of health for is the preventing diseases through the vaccination. Expanded program on the immunization was launched in the 1978, and it is renamed as Universal Immunization Program in 1985. 1992, it is become a part of Child Survival and Safe Motherhood Program, and it is mainly this Universal Immunization Program is one of the largest public health program targeting close to the 2.67 crore newborns and 2.9 crore pregnant women annually. It is one of the most cost-effective public health interventions and largely responsible for reduction of vaccine preventable under 5 mortality rate. We'll see the around 12 vaccine preventable diseases you can prevent through this vaccination. It is a diphtheria, pertussis, tetanus, polio, measles, rubella, severe form of childhood tuberculosis, hepatitis B, meningitis, pneumonia caused by Haemophilus influenza type B, rotavirus, diarrhea, pneumococcal pneumonia, Japanese encephalitis. This is for the under 5 children, but other than apart from there are the 3 more vaccination playing the crucial role in the immunization program is the COVID-19 vaccination. All of you know about in detail, so I will not elaborate. Only Corbevax, Covishield, Covaxin, Sputnik, Naso vaccine. So many vaccines are available. Now, hepatitis B vaccine, it is very much neglected part. Every healthcare individual should be take hepatitis B vaccination at the interval of 3 courses, 0 dose, 1 month course, and the 6 month duration. And after 15 years of 3rd dose, it should be taken as a booster dose. Main drawback of this hepatitis B vaccination is the up to 2 doses will be completed successfully, but later on the person or the health professionals are forget to take the vaccination of the 6 month and after the 15 years as a booster dose. Now the next vaccine is the quadrivalent inactivated influenza vaccine. It is mainly for this pandemic of H3N2 virus or H1N1 influenza vaccine. Mainly you have to check the quadrivalent inactivated influenza vaccine for the latest strain. They have described the strain on the packet, that is 2021 strain, 2022 strain, 23 strain. You have to check and take the latest one. Latest one is the 22 or 23 strain. You can take it. It is free of cost at the government for the health professional and the pregnant woman for the RH and above level facilities. It is free of cost for the health. Other person, it should be a take as a purchase. These are the other vaccination. Mostly it is neglected part. So I have covered in this. Now we'll see the just which are the vaccines I have listed here as per the National Immunization Program. New vaccines like private practitioners, all the vaccines are covered here. At the birth, breastfeeding is the first vaccination. BCG, OPV, hepatitis B, it is counted as the birth dose. 6 weeks interval. OPV, rotavirus, fractionally inactivated polio vaccine, pneumococcal conjugate vaccine, pentavalent vaccine first dose. 10-14 weeks, it is a second and third dose. 9 months, again, fractionally inactivated polio vaccine, third dose. Measles rubella first dose. JE is only for the epidemic state, district they have given, not in Ahmednagar, it is started. PCV booster, you can give 16 to 24 years, OPV booster, measles rubella second, DPT booster. Up to 5 to 6 years, it is school health program. You are providing the DPT booster second, 10, 16, and the pregnant woman, you are not provided TT. It is called as the TD, adult diphtheria and tetanus toxoid vaccine. Previously, you are providing the TT vaccine, that is tetanus toxoid vaccine. Now the government has started with the adult diphtheria and the tetanus toxoid. It is called as the TD vaccinations. We are started at the 10 years, 16 years, and for the pregnant woman. Now, third one is the protecting people from the pandemic. All of you know the health emergencies from cholera, Ebola to avian flu, SARS, COVID-19 pandemic, and now recently is the H1N1 influenza. All of you know that this is the influenza virus structure. It is mainly H, that the hemoglobin initiated infections following attachment. It is only H antigens having the 16 types. Numerator is NA, release of virus from the infected cell, that is 9 N antigens and the different combination. All of you know the H1N1, that is these antigen strains. Out of 16, they have given the one. Right now, currently is the pandemic, our state having the H3N2. These are the like IC we had done for the influenza. What are the signs and symptoms? What are the preventive measures? You can do it mainly for the hand washing, nutritious diet, take the vitamin C rich diet, avoid take a proper rest and drink plenty of waters. Avoid the handshaking, avoid the spitting in public places, do not take medicine our own. If you have any flu like symptoms, avoid in the crowded places, wear the mask. Likewise, the infection they have given here. What are these are the IC material I have just pasted here. What are the preventive measures and what are the symptoms? You can do it. And what are the risk factors group like the pregnant woman, infant, geriatric populations, those immunocompromised patients, those having the medical or surgical disease conditions, those on the regular long-term treatment. These are the high-risk group for this. How it will be spread from one person to one contact, from the sneezing or droplet infections, it can be a spread. These are the some IC material I have posted, and for this they have given the categorize A, B, C. Government has make a advisory on the H3N2 influenza, and they have make it is as per their sign and symptoms and what are the treatment they have given. Drug of choice is the acetaminophen, is the tablet is given for this H3N2. These are as per the weight, as per the age, they have given the doses for the as per 15 or below 15 years, 30 milligram. It is a BD dose for 5 days. 15 to 23 weight person can 45 milligram BD dose for 5 days. Up to 23 to 40 kg weight person can take 60 milligram for BD dose for 5 days. Above 40 kg weight person will take 75 mg for BD dose for the 5 days. Now the current state of the Maharashtra test up to the January to the April is only for the 3 months. The January, February, March 3 months data. H1N1 infected persons are the 451, H3N2 was the 365. Right now admitted 98, and the death for H1N1 3, H3N2 was the 5. Out of that, 1 is from our Ahmednagar district. Now, fourth aspect is for providing health for all, which are the guidelines, policy, and standards for the health. Advisory is published from the state of government or the Ministry of Health. It should be followed. Like all of you know, the COVID advisory, most of the times coming. Now the influenza advisory is coming. Likewise, which are the policy guidelines are coming, standards for the health, we have to follow. Next is addressing the climate-related health challenges. This is the mainly action, that is the 13th goal of this sustainable development is the climate action. Now, climate change is the biggest health threat facing the humanity today. Its impact on the air quality, drinking water, food supply, sanitation, shelter, and the environment as a whole. And this again spread the infections and the diseases in the community. Climate change is often associated with the ecosystem destructions and disappearing of the species. This is all true, but climate change affects our lives in more direct way, our health. You will see the in diagrammatic presentations I have done here from the air pollution, asthma, cardiovascular, mainly 4. You will see in the middle circle, there are the main 4 climate change. They are given: increased carbon dioxide levels in the air, rising sea levels, more extreme weather, rising temperatures. These are the 4 main climate changes will affect our health system. That is first one is the increasing the allergies, that is the respiratory diseases, asthma, air pollution, that is the again asthma, cardiovascular diseases, food supply problem, again malnutrition because of the heavy drought or the heavy rainfall will have the food supply problem, will end up into the malnutrition, social problem for the migration, mental and social health problems, severe weather events like injuries, death, damage to the healthcare facilities, extreme heat will cause the heat-related illnesses and the cardiovascular diseases, water problem like cholera, diarrheal diseases, change in the vector ecology, which will lead to the malaria, dengue, chikungunya, Japanese encephalitis. Likewise, these are the effect of the climate change on the human health will be a more addressing. These are the climate, just previous slide only we are discussed. Likewise, which are the change in climate, what is the effect and how the health impacts on what are the interventions we'll take. Now, next is addressing the antimicrobial resistance is for the health for all. Over a decade, we have seen both the misuse and overuse of the modern medicines. As a result of our common defense against disease have weakened. This has to lead the appearance of new microbes resistance to the known medicines, and they have threatened the progress we have made in better health and longer the lifespan. I'll give the next slides some of the examples how it is going to affect antimicrobial resistance is the development and global health threat. Now, these are the just definition. What is the antimicrobial resistance occurs when the bacteria, virus, fungi, and parasite change over time and no longer respond to the medicine, making infections harder to treat and increasing the risk of diseases spread, severe illnesses, and death. As a result of drug resistance, antibiotics, other microbial medicines become ineffective and infections become increasingly difficult or impossible to treat. These are the spread of the antibiotic resistance, how it is spreads and all. Most of the times, all of you taken the antibiotics for any disease. If you feel 1 or 2 days, you are discarding that medicine on the ground of the earth, and it is mixing in the soils, and it is again mixed with their contents into the which are our natural sources, that is underground water and all. Recently, one of the person has done the survey. He has analyzed the water quality samples for the chemical analysis, and he has found that the more NSAID drugs components are seen in the water intake, which are the sources of water he has taken because of the various reasons. And now it is you are indirectly drink with the waters that all the medicines. If you want to resistance, 5 things to know that antibacterial resistance occur when germ defect the drug resistance to kill them, called the antibiotics or antifungal. It does not mean by your body's resistance or the antifungal. It can affect people and save that infection cause resistant germs and difficult, sometimes impossible to treat. If you are used for yourself, protect and stop germ from spreading, like hand washing, vaccinations, clean hand, good care of chronic conditions, you can take it. Now you'll see what is the present situation, why I have taken this antimicrobial policies like threatening. First, we'll see the drug resistance in the bacteria. For common bacterial infections, including urinary tract infections, sepsis, STDs, some form of diarrhea, high rate of resistance against the antibiotic frequently used to treat these infections have been observed worldwide. For example, the rate of resistance to ciprofloxacin is antibiotically commonly used to treat UTI, urinary tract infections. It is resistance from 8.4% to the almost 92.9% is it resistance to all the people. Now these drugs cannot be used for the treating the UTI. Now next drug is for the drug resistant Mycobacterium tuberculosis. If you see the antibiotic resistance Mycobacterium tuberculosis, strains are threatening progress in containing the global tuberculosis epidemic. WHO estimated in 2018 there were about 500,000 new cases of rifampicin resistance TB, RR TB, that is called, identified globally, of which was the vast majority of the multi-drug resistance TB MDR. It is called a form of tuberculosis that is resistance to be most powerful anti-TB drugs. Only 1/3 of the approximately 500,000 people who develop MDR rifampicin resistance tuberculosis in 2018 were detected and reported. Third is the viruses, drug resistance in the viruses, increasing concern in immunocompromised patients population, where the ongoing viral replication and prolonged drug exposures lead to the selection of resistant strain. Resistance have developed to most antiviral, including the antiretroviral, that is ARV drugs. ARV drugs includes newer classes are at risk for becoming partially or fully inactive because of the emergence of drug resistance HIV. People receiving antiretroviral therapy can acquire HIV drug resistance, and people can also be infected with HIV that is already drug resistance. The level of permanent HIV drug resistance to non-nucleoside reverse transcriptase inhibitors among adults initiated first-line therapy exceeded about 10%. Now the drug resistance malaria. Malaria drug of choice, ACT, is the combination of acetramine components, and it is effective for the P-falciparum resistance, and the sulfadoxine pyrathamine leads to the acetrase sulfonamide pyrathamine failure. Spread of this resistance to acetramine and the ACT partner drugs could cause a major public health challenges and jeopardize importance gain in the malaria control. Now the malaria cases control, but this acetramine resistance is now a big challenge for the malaria control. Now the fungi infections will take the drug resistance fungal infections increases and express experted as already difficult to treat the situations for the HIV patient, drug resistance candida auris. One of the most common invasive fungal infection is already widespread with increasing resistance reported to fluconazole, amphotericin B, voriconazole, as well as emerging captofungi resistance. This is leading to more difficult to treat the fungal infection, treatment failure, longer hospital stay, and much more expensive treatment option. Antimicrobial resistance, these are the few just due to the time lapse. I have expanded only the 4 or 5 conditions like which is more alarming in the community for the health individuals. MR is a complex problem that requires a united multi-sectoral approach. The One Health approach brings together multiple sectors, stakeholders, engage in human, pescatarian, aquatic animals, plant, health, food and feed productions and environment to communicate and work together in design and implementation of programs, policies, legislations, and research to attain better public health outcome. Now, 7th most important for the health for is the tackling non-communicable diseases. WHO has been working to protect people from key risks that leads to chronic diseases such as tobacco use, physical inactivity, harmful use of alcohol, and unhealthy diet. This risk leads to disease and conditions such as diabetes, cancer, stroke, associated trauma, suffering account 74% of all death worldwide. These are the some program is listed here, which are the non-communicable diseases are bring about the national program for the prevention and control of cancer, diabetes, cardiovascular diseases, and the stroke. It is called the NPCDCS. It is launched in the 2010 with the focus on the strengthening infrastructure, human resource development, health promotion, early diagnostic, management, and referral for about 30 years of the individual or the adult. It will be a screen by the health personals for the 5 disease condition, mainly for the diabetic and the hypertension. Diabetic, you will see the diabetic prevalence. It is the 12% of the prevalence steadily increasing from 7.1%. Now, hypertension is overall prevalence of hypertension among the adults in India is about the 30%. Now, with the urban prevalence, it may be varies, it be more than the 34%. In this program, the diabetic and hypertension screening will be done yearly, and the testing of the blood investigations will be done free of cost at the health facility by the HLL. In the laboratory samples collections will be done, and it will be tested free of cost. All the investigations will be done. Now, second most program in this is the cancer. Cancer, first one is the cervical cancer. In the basically only 3 cancers under this program, they are screening: cervical cancer, breast cancer, and the oral cancer. Cervical cancer will see it will be contribute in India approximately 6 to 29% of all the cancers in the woman. Now, for these detections, sign and symptoms and all which are the risk behavior, I will not go in detail. Mainly new initiative government has launched at the PHC subcenter level. It is the VIA test, visual inspections by acetic acid test. It is the available at the PHC or subcenter at the grassroots levels to identify the cervical cancer. Now it is mainly for the 5% of acetic acid. It will be adding 5 ml of the glacial acetic 5% acetic acid, and it will be apply on the cervix. It will be a detailed procedure. We'll take a separate lectures. Mainly what is happening here, we'll see that only the aceto-white lesion, only 1 minute is required for these procedures. You have to apply the acetic acid, this 5% of acetic acid on the cervix, and observe the cervix for the result. Mainly in the cervix, what will be the see that the dense and defined opaque, dull, or the optic white, that is called the aceto-white areas with the regular or irregular margins close to the apparent and the squamocomular junctions in the transformation zones or close to the external os in the squamoscapular junctions is not visible. Shrinkling dense aceto-white areas, the cervix become densely white after the application of acetic acid. Condyloma and leukoplakia occurs close to the squamoscapular junctions, turning intensive white after the application of the acetic acid. These are the just, I will broadly explain about the VI test. We'll take the detail about the VI test, how it will be application with the slide. We can see the how it will be identified with the cervix after application. This is the one-day training will given in the health professionals how to identify the cervical cancers with the help of VIA test, visual inspection by acetic acid. Previously, we are doing the pap smear. Nowadays, we are in the health institutions will not do the pap smear, will take the VIA test. Next one is the breast cancer. It account about the 30% of new female cancer each year. Mainly the breast self-examination is the breast self-examinations is the most effective and diagnostic tool, and will teach for the each individual for the breast self-examination by the ASHA or the ANE. Oral cancer, it is amongst the main, about 11.28% of all cancers, and the fifth most frequently occurring cancer among the women. And it is the mainly oral self-examination. We are taught about the healthcare professionals how to do the oral self-examination. With that, they will detect with the oral cancer and refer to the respective institute for the treatment and the other diagnostic level. Other program I have just enlightened here, the National Mental Health Program. Under that, the Manashakti Clinic is the new initiative, and Memory Clinic at the district hospitals for the dementia patient. Manashakti Clinic at the PHC levels. Every one day is the Wednesday is the fix for the mental health day and the mental health OPD, and they will counsel treatment and the investigations will be done at the PHC level. Program for the healthcare of elderly, program for the prevention and control of deafness, tobacco control program. Mainly COPTA Act will be implemented, and the tobacco free schools will be a most emerging part of this control program. Oral health program, program for palliative care. Now the palliative patients care for the cancers and other regimes. National program for prevention and management of burn injuries is the new initiatives coming up. National program for prevention and control of fluorosis. It is the most common program and newly program launch for the fluorosis. All of you know what is the fluorosis and all. Mainly the we'll see it is launched in 2014, but it mainly for the fluorosis. The main intake of the fluorosis from as per the age group, it will be varies from 0.01 microgram to the 4 microgram. We'll see the toothpaste also. We'll see that the fluoride content toothpaste and all it is come up. Now the National Iodine Deficiency Disorder Control Program, it is known as the Goiter Control Program, and the government has launched the thyroid missions in the January 2023. This is a recently activity government of Maharashtra has started, and with this they are giving the counseling about to use the iodinized salt in the health at the household level, and with here with the help of ASHA they are going to test. The salt testing will be done from the sellers and the home salt or the any shopkeepers. They will take the samples of salt and it will be sent for the testings. Or ASHA is given the STK salt testing kit. STK kit is given, and it will be a test whether the right proportion of iodine is there or not. For the pregnant woman, they have been done the 3T, 3, 4 and TSH testing for the government free of cost. National program for control of blindness and visual impairments. All of you know they are providing with the hearing aids to the peoples. Communicable diseases, it is the mainly first was the revised National Tuberculosis Control Program, RNTCP. All of you know about this program, but I will just mainly highlight about the Nishay Mitra. all of you seen about the most of the times you have given the pamphlet of the MHS also circulated. All of you take one Nishay Mitra. What is the long form of Nishay? Ni means the end and Kshay means the TB. So it's a combination. They have made the Nishay. The website launched for the TB control under the national NTEP program. It is mainly for provide the Nishay Mitra. It is the concept for individual, NGO, political parties, corporate, institutes, elected representative, etc. They can support TB patient for a period of 6 months to the 3 years for their nutritional requirement and the medicine. Nishay Mitra will be for in the 3 form. They can take a help of for the nutritional support. That is the food basket. It is called. They have provided mainly the protein-rich food in the food basket. Each basket costing of around 500 rupees, and they have to provide to the TB patient and at least 6 months. Next one is the diagnostic support like MRI, CT scan, or any other investigation is needed. As per the actual cost, whichever the person has taken, donor will take. And third one is the vocational support. That is the as per his qualification, you can provide the vocational support. This is the Nishay Mitra is the new concepts, and the government want to end this TB. Recently has organized the World TB Day. This is the theme for this year. Yes, we can end the TB. And government want to end this TB eliminated by 2025. 25th, in next 2 years, they want to reduce the global ending TB in the public health threat. Next, leprosy eradication, integrated disease surveillance, IDSP. IDSP mainly is the website portal for the website portal. It is one of the major national health program. In this, the key objective program is to strengthen, maintain decentralized laboratory-based IT-enabled disease surveillance system. Here, the daily basis, the SPL forms are filled: symptomatic, presumptive, and the laboratory form. These are the 3 forms daily filled up by each health facility, from starting from the subcenter to the district hospital, so that the Maharashtra or the national level, they come to know which are the diseases will upcoming in the country or the state. This is a new IT-based initiative, daily reporting system they have given. These are the vector-borne diseases. We have seen them mainly the lymphatic filariasis, Kala Azar, acute Japanese encephalitis, dengue, chikungunya. Will not go in detail about this. We'll see the next one is the about non-communicable diseases, the healthy diet, food triangles has suggested and given food. Eat most, mainly for you have to eat most, eat more, eat moderately, and eat less. Eat less in that the fat, oil, salt, and sweets. Government has given the 5 microgram salt per day per person should be consumed. Now we will see that the 1 packet of the salt and how many members you are in the household, we will calculate, and how much salt you are using in daily consumptions, you can see. Government has restricted 5 milligram per person per day is the requirement of the salt. Oil, one oil is not the good for the health. You have to change, like the groundnut oil, soybean oil, or the variety of the oils are available in the market. You don't constant on the one oil. Eat mostly, that is the grains and cereals. Eat more, that is the fruit and the green leafy vegetables. Seasonal fruits, they want to see the seasonal fruits, you can eat morely. These are the diet pattern should be followed. What is the effect of unhealthy diet? Become overweight, certain cancers, inability to fight infection, risk of catching more infections, high blood pressure, high blood sugar level, tooth decay, gum diseases, heart diseases. Likewise, these are the unhealthy diet. These are the diet exhibitions we are done in the PSC levels for the promoting examples. Now, next is the physical activity. Physical activity is body movement that involves the use of muscles of the body and requires energy. For example, of physical activity will be walking, running, jogging, cycling, playing sport, dancing, swimming, climbing, stairs, and yoga. Now, this how much physical activity we need for an adult. The government has make a norm that at least 150 minutes of moderate exercise per week that can be spread into the per day. It will be a 30 minutes. At least you have to per day do the normal moderate exercise form of like this. This for the government of Maharashtra has organized the cyclothon on the 14 February 2023 for the Arogya Sati cycle. That is the theme they have taken, and they have made that the cyclothon. Form of exercise like the yoga, all of you know the benefits, and the all will not go in detail. At the sub-center and the PSC levels, we are under the activities. We are doing the yoga sessions and meditations to all the individuals in the group forms. We will do the yoga weekly basis. It is not regular, but once a week we'll do it. Form of exercise, meditation will not go in detail. Most next part is the Ayushman Bharat Health and Wellness Center. That is, you have seen in the PSC, previous slide, the logo and this is the change here, Varli, Ayushman Bharat, Varli painting on the PHCs and all this make is the interactive buildings. This Ayushman Bharat logo, it is most attempt to move from a selective approach to the healthcare to deliver comprehensive range of services spanning preventive, promotive, curative, rehabilitative, and the palliative care. HW Health Wellness Services are innovative to deliver expanded range of services to go beyond maternal and child health care services to include care for the non-communicable diseases, palliative, rehabilitative care, oral eye and ENT care, mental health, first level care for emergencies and trauma, including free essential drug and diagnostic services. These are the 12 services are provided from the HWC, first care for the pregnancy and childbirth, neonatal and infant health care services, childhood and adolescent health care services, family planning, contraceptive services, and other reproductive health services, management of communicable diseases, national health program, management of common communicable diseases like general outpatient care for acute simple illness and minor elements, screening, prevention, control, and management of non-communicable diseases and chronic communicable diseases like TB and leprosy, basic oral health care, care for the common ophthalmic and ENT problem, elderly and palliative care services, emergency medical services, screening and basic management of mental health element. These are the 12 services are provided through the HWC. Now the PHC, now we are not seeing as a PHC, primary health centers. Now it is called as the Health Wellness Center. That is the Arogya Vardhini Kendra. Previously we are called as the Prathamik Arogya Kendra. Now it is named as revised as the Arogya Vardhini Kendra. It is called as the Health Wellness Services. And these are the services given under the HWC or the Arogya Vardhini Kendra. These are the Arogya Vardhini Kendra. Some of the PHC pictures I have plotted here. Mainly the branding is the concept. So all the PHC and sub-center health institutions this is the typical color will be given. And these are the Varli paintings will done on the on the wall, and the logo of Ayushman Bharat and the Arogya Vardhini Kendra. This is, for example, Arogya Vardhini Kendra Padega. This likewise here they have written. Now these are some of the Arogya Vardhini Upakendra Shela. This is Apollo PHC, Ayushman Bharat, Arogya Vardhini Kendra. You can see here. Next one is the for all of us is the Ayushman Bharat Digital Mission. Government of Maharashtra and the Family Welfare Department has launched the Aabha number. Like your Aadhaar card or the PAN card, the Aabha number is compulsory for each and every individual. It is the only way to ensure that the create medical records and issues to be corrected individual to assess by health information users through the appropriate concern. With this account, this Ayushman Bharat Health account, this Aabha number or the Aabha account number will be used to for the purpose of uniquely identifying person, authenticating them, and treating their health records across the multiple health system and stakeholder. Here you are going to put store all your health laboratory investigations record, what are the treatment you are given on this one click number all over in the India or the abroad. They are going to digitally spread it. All the persons should be a generate your Aadhaar number from the Ayushman Bharat Digital Mission website. Likewise, this my Aadhaar number. It's this certificate or the ID will be generated from the National Health Authority. Henceforth, the government is planning to Aadhaar number should be a mandatory for all your health policy documents, and those are screened at the 30 above population in the PSC. You are creating his Aadhaar number and doing all the investigation and the treatment record on his Aadhaar number ID. If you go or here visit nearest health facility, they will generate your Aadhaar number free of cost. For that, you need only Aadhaar card and your mobile number, Aadhaar base your mobile number. These two documents are needed for this. Next is the healthcare professional registry. This is again only for the doctor and nurses in the state of Maharashtra and India. Across the India, the healthcare professional registry is the mandatory among the Ayushman Bharat Digital Mission. Empowers the health professional registry on board healthcare professional on its Indian digital health ecosystem and connect patient to healthcare provider or vice versa with the latest milestones. With this, you can identify that it is a certified person for the public that he can authorize or practice medicine in the country. This ensure that only healthcare practitioners suitably trained and qualified to practice medicine with competence and ethical compliance can register with the health professional registry and ensure public good. Likewise, we will get the health professional registry from the website, and this is my health professional ID number. Each nurses and doctors, it is mandatory to do the health professional registry. Health facility registry. Now each and every health hospital, clinic, diagnostic laboratories, imaging centers, pharmacies, etc. all should be registered on this portal, and they will get as the certificate. And all of you know the Bombay Nursing registration renewal should be done from all the hospitals and clinic will be done from this health facility registry only. Now for that again they will require the health professional registry also, otherwise they will not register for the facility. Now the last concept of this caring for those who take care of us. Likely we all of us we have to take care of all of us having the bed possible thanks to the tireless effort of generations of health work around the world, promoting the work of health workers who have made all these health landmarks happen, from the eradications of smallpox to dramatic progress in delivering COVID-19 treatment. Further promoting the role of health workers, particularly nurses, in achieving health for all. Now the government of Maharashtra today, we are celebrating the World Health Day with the announcement of the Sundar Maza Dawakhanas. This is a theme they have taken, state government of Maharashtra, in view to celebrate the World Health Day. In this campaign, they are going to clean all the health facility. Like here we are seeing the cleaning and mopping around the area, inside the area, all the equipment will clean. And second thing is your hospital name should be displayed properly on the board. And if you feel your hospital is clean and tidy, the patient will come across to take care of their own health. This scheme will be implemented to the 7 to 14 April 2023. In the broad name is the Sundar Maza Dawakhana. Now the end of this lecture for this health for all. Now, likely I want to briefly summarize and will take this end of these sessions. Like I will mostly comfortable with in Marathi. All of you may be comfortable in the Marathi. We'll see that health for all. That means that the सर्वांसाठी आरोग्य. Now सर्वांसाठी आरोग्य कशासाठी येते तर जग वेगाने बदलत चाललंय आणि प्रत्येकाची जीवनशैली तेवढ्याच प्रचंड वेगाने बदलत चाललेली. जीवनशैली बदलल्याने प्रत्येक जण केवळ आपला स्वतःचा विचार करतो. हवा प्रदूषण, पाणी प्रदूषण, विषमुक्त अन्न, प्रचंड महामारी, सुनामी, भूकंप, वादळी वारे, दिस इज अनेक प्रश्न आपल्याकडे उपस्थित आहे. हवा, पाणी, अन्न या माणसाच्या मूलभूत गरजा ज्या निसर्गाने आपल्याला मोठ्या प्रमाणात आणि विनामूल्य उपलब्ध करून दिलेल्या आहेत, त्या आजच्या माणसाला चक्क बाजारात विकत घ्याव्या लागतात. ही आपली अधोगती म्हणायची का काय? याच पार्श्वभूमीवरती जागतिक आरोग्य संघटनेने हेल्थ फॉर ऑल, दॅट इज सर्वांसाठी आरोग्य अशी घोषणा आपल्याला करावी लागत आहे. विज्ञानाने प्रचंड वेग धारण केलेला आहे. डिजिटल तंत्रज्ञानामुळे आपण सर्वजण जोडले गेलेले आहेत. बहुसंख्य जनता अनेक समस्यांना तोंड देत आहेत. जीवनातील मूलभूत गरजांना वंचित असलेली जनता अनेक प्रश्नांना तोंड देत आहे. यातील आरोग्याचा प्रश्न सर्वांचाच महत्वाचा. अज्ञान, त्याच्या पाठोपाठ दारिद्र्य, लोकसंख्या वाढ हे दुष्ट चक्र सुरूच राहिल्याने 2 वेळा पोट भरण्यासाठी त्याला यातायात करावी लागते. अन्न, वस्त्र, निवारा, त्यातही शुद्ध हवा आणि शुद्ध पाणी यापासून तो अजूनही कोसो दूर आहे. उत्तम आरोग्यासाठी स्वच्छता आणि त्यासाठी उत्तम शौचालय, मलमूत्रांची आणि कचऱ्याची आरोग्यदायी विल्हेवाट व्यवस्था जगातील वंचित घटकांना आजही ती उपलब्ध नाही. दारिद्र्य आणि अज्ञान याच्यामुळे अनेक जण व्यसनांच्या विखळ्यात अधिकाधिक गुंतत चाललेले आहेत. गर्दीची वस्ती, स्वच्छतेचा अभाव यामुळे संसर्गजन्य रोग सदैव आपल्या साथीलाच आहेत. या सर्व गोष्टींबरोबर स्त्री पुरुष भेदभाव, स्त्रियांना हीन वागणूक, आरोग्य हा प्रत्येकाचा मूलभूत हक्क आहे. तो मिळायला हवा. प्रत्येक व्यक्तीला आरोग्याच्या मूलभूत सुविधा मिळायला हव्यात. स्वच्छ पाणी, स्वच्छ हवा, पुरेसे सकस विषमुक्त अन्न गरजेचे आहे. आजारी पडल्यावर आजाराचे निदान आणि उपचार हवेत. कमीत कमी खर्चात औषधं मिळायला हवेत. पुरेशी आरोग्यदायी व्यवस्था हवी. महापूर, भूकंप यासारख्या आपत्तीवर मात करण्यासाठी येणारी यंत्रणा हवी. संसर्गजन्य रोग तर मुळापासून निघायला हवेत. माणूस हा समाजप्रिय प्राणी आहे. चांगलं जगणं नशीब येण्यासाठी त्याला आरोग्य तर हवंच, पण त्याचबरोबर भोवतालचं वातावरण निरोगी हवं. जगणं सुसह्य होण्यासाठी मूलभूत गरजांबरोबर समाजही निरोगी हवं. ओम सर्वे भवन्तु सुखिनः, सर्वे सन्तु निरामया, सर्वे भद्राणि पश्यन्तु मा कश्चिन्न भाग्यवन्त. ओम शांती शांती. May all sentient beings be at peace. May no one suffer from illness. May all see that in Aquarius. May no one suffer. Om Shanti Shanti. And thank you for your patience listening and your contributions. And all of once again, thank you for the organizers. They have invited me as a guest speaker for this today's World Health Day theme. Especially thanks to the Dr. V.K. Patil Foundations, College of Nursing, Ahmednagar, Principal Madam Dr. Pratibha Chandekar Madam, and Dr. Yogita Avtade, Vice Principal Madam, and all their college team members, and with that the State TNA branch. Thank you for inviting, and once again all of you having the Happy World Health Day. Thank you.
Thank you, sir, for elaborating your views on this. Very vastly you have told, and each and every program you have been touched with, and I hope that, I'm sure the student will be benefited out of it, the faculty will be upgraded out of it. And thank you very much for sharing your views and sparing your time with us. I hand over to the next session to Mr. Amol Sheke for vote of thanks. Thank you.
Thank you, ma'am. On behalf of Dr. Vittalrao K. Patil Foundation, College of Nursing, and Maharashtra State Branch, I would like to extend my heartful gratitude to our esteemed guest speaker, Mr. Sandeep Kale sir, for sharing such important and useful information regarding health for all, strengthening primary health care to build resilient system. Thank you, sir, for sharing briefly regarding communicable and non-communicable diseases, regarding immunization, regarding different schemes and agencies. I also thank Sureka Samant Madam, TNI President, Maharashtra State Bench. I also thanks to Mrs. Prachi Dharap Madam, TNI Secretary, Maharashtra State Bench, and Dr. Pratibha Chandekar Madam, Principal, Dr. Vittal Ravike Patel Foundation College of Nursing, Ahmednagar, and Shilpa Shettigar Ma'am, Dr. Yogita Avtade Ma'am, and all participants for attending this webinar on the occasion of World Health Day. Thanks to all, and thanks again, sirs and madam. Thank you, all of you.
Thank you.
Thank you, madam, and thank you all the organizer and participants for patience listening of my speech. And thank you once again, all of you organizers and participants.
Yeah, Sandeep, see, till 1 hour, 100 participants were there in the Zoom link. Right? And then after 1.5 hours, 80 participants, and now also 75. So that means everybody is really interested to listen to you. And then it is a very good topic and excellent deliberation by you. Covered health for all. So all age group, all aspects and all health aspects that you covered, which are really a practical application and which is really necessary. And you are a practical public health person and you shared your view. I'm sure Prachi will definitely agree, right? And I think, yes, Prachi, definitely you also will agree with me that he has covered the entire umbrella of all things, preventive and promotive aspects, which are really essential for health for all, and how government things that are there. So really, I appreciate your vision. Excellent, very good.
Thank you, ma'am.
Prachi, you would like to conclude, give some concluding remarks? Please go ahead.
Yes, thank you. I'm out. That's what I was listening throughout the session. It was a wonderful, elaborative sessions and in-depth. And of course, he has dealt with each and every aspect. What is the community base? I was impressed with the each and aspect he has covered on the community base. So the all students who were attending nearly will get the insight of what is the community health worker or a community health nurse does at the community level. So thank you very much, sir. And we will be in touch constant and we'll have further more sessions with you. Thank you.
Okay, sure, madam.
Thank you, madam, to you also.
Okay, thank you so much once again to everyone.
Thank you. Thank you all the participants and organizers once again. Thank you.
Okay, bye-bye.